Dear colleagues, good afternoon. Unfortunately, I could not be with you in person at this interesting summit, but it's a pleasure for me to speak to you at the 5th International Summit today. The UN Decade of Action on Nutrition, which was proclaimed in 2016, is now well underway. As we approach the midpoint, I have both good and bad news to share. Let me start with the good news. First, in 2000, 32.5% of children under 5 were stunted, a figure that has now dropped to 21.9% in 2018. Second, many countries are on track to achieve at least one of the global nutrition targets. But the bad news is that progress towards ending malnutrition in all its forms has been slow and uneven across the world. Unhealthy diet is now the top risk factor for both communicable and non-communicable diseases. Levels of wasting of children under 5 and anemia amongst women of reproductive age are still high, with 7.3% of 49 million children wasted in 2018, and 32.8% or 613 million women of reproductive age anemic. On average, 1 child in 6 is born with low birth weight, but in some South Asian countries, the prevalence can be as high as 28%. Childhood overweight and obesity is rising almost everywhere, and only about 40% of infants under 6 months of age are exclusively breastfed. These numbers are truly staggering, and I'm sorry I had more bad news than good news. However, this is an unprecedented moment. So we have the tools, the potential, and urgent responsibility to make lasting impact and accelerate progress towards reaching our goals. In addition, the global community is increasingly recognizing the foundational role nutrition plays in all health and well-being. With most countries now facing a double burden of malnutrition, we need health practitioners everywhere working on the front lines and interacting directly with people to join us in this collective effort. How effective are we in translating global nutrition guidance into concrete advice to people who need it? Nutrition capacities of those making the most concrete impact on lives need to be built. A motivated and well-trained health staff everywhere is essential for the proper prevention, management, and treatment of nutritional deficiencies. This was recognized in the 2014 Second International Conference on Nutrition and its outcome documents. Yet, there has been far too little investment to build capacity for nutrition. In 2016 to 2017 globally, the median density of nutrition professionals, which is an indicator of the global nutrition monitoring framework, was only 2.3 per 100,000 population. This global density is far too low given that unhealthy diet and poor nutrition are so important for health. Now, more than ever, in this nutrition decade, we must roll up our sleeves and build nutrition capacities to foster healthier populations. This means training healthcare professionals on nutrition, including medical doctors and nurses, and leveraging the existing workforce of dietitians and public health nutrition. I'm sure we can do it together, and I look forward to working with you. I wish you a very good conference.